I list basically three things that are most significant. One is increased government intervention, insurance companies not being able to compete across state lines, and this monopoly or cartelization of the medical professions and professionals and medical schools. So, Jake, I want to throw it to you. What do you think?
Well, hearing that whole history, which I'm pretty familiar with, although I wasn't alive at that time, through Medicaid in '65 and the HMO Act in 1973, I like to point out that, one of the really crucial things to also remember is inflation and the currency. Because what you hear a lot of these days, sometimes actually more on the Republican side than the Democratic side, but a Republican politician might sound, all fiscally conservative and everything for a while, but they never, save for Congressman Ron Paul, what you never hear is them talking about a sound currency. And the reason they don't is because they use inflation to steal your purchasing power away. And what's been happening over time, we used to have a monetary system based on gold and silver, and a silver dime in 1965 could buy a loaf of bread, and a silver dime today, you take it to a jeweler, get the cash for it, can still buy the same loaf of bread. So something's been happening to that money, and what's been happening to the money is it gets diluted by the creation of new dollars by the Federal Reserve. And as this has been occurring, what you see is, the price of health care, which is a good and a commodity and a service all wrapped up together, is going up higher every year. And so is your salary. But the inflation rate of the good and the commodity and the service for health care is increasing at a faster rate than people's salaries. So every year you spend a higher percentage of your salary on health care. So it is getting more expensive in the sense that it's taking up a higher percentage of your salary. But in reality, you're getting poorer. And you're getting poorer because the government is taking away your purchasing power directly from your wallet because your money is not tied to anything except for worthless Treasury bonds and Federal Reserve notes.
Well, and the other thing is that if you go back to 1975 and you look at what a cost of a color television set was then and what the cost of a color television set is today, it's about the same in terms of actual dollars. And in terms of inflation, it costs much, much, much less. And yet we have many, many more features. We have flat screen TVs and so on and so forth. And that's because why? There are no real restrictions, government restrictions on the production of these things that amount to anything. And so in healthcare, as in anything else, what we want are personal choices, higher quality, lower prices, and that's what we're all looking for. And the government solutions boil down to fewer choices and lower quality and higher costs, which are then all transferred to the taxpayers, all of us. So in any case, we're going to have to wrap it up today. It's unfortunate that we are running out of time. I want to thank you, Jake Towne, for being with us, and Miss Meghan O'Toole for being with us today. And this is Michael McKay on Radio Free Market. Please visit us on the web at radiofreemarket.com, and we'll talk to you next week when we have Dr. Yuri Maltsev talking about socialism and its effects on American culture. Talk to you then. Thank you very much for listening.